time, the Food Exodus Project. Okay, so as you all know, this is a faith-based agency, and we certainly don't want to hammer anybody over the head with that, but we do begin our ACHEC meetings, our Allen County Health Equity Coalition meetings, with a short prayer or meditation. When I got up this morning, and if that's offensive to you, I won't be offended if you turn off your video camera, turn down your volume, come back in about 2 minutes, and we'll be ready for you. When I got up this morning and I saw that the temperature was -3, okay? Negative in front of the 3, the coldest day of the year. You know what I'm going to do? I am going to be thankful nonetheless, okay? And so I think that it would, despite these blistery weather conditions and the cold, I think that gratefulness is something that goes beyond religion, denomination, and all of that. It is something that helps us to live joyfully. And so I want to read to you this prayer. Shout with joy to the Lord, all the earth. Worship the Lord with gladness. Come before him singing with joy. Acknowledge that the Lord is God. He made us and we are his. We are his people, the sheep of his pasture. Enter his gates with thanksgiving. Go into his courts with praise. Give thanks to him and praise his name. For the Lord is good. His unfailing love continues forever, and his faithfulness continues to each generation. That is the 100th Psalm, and I like to read that and think about that when I don't necessarily feel all that grateful and cheerful. When I read that and I think on that, I say, you know what? There are some people who wish they could feel the cold air and the breeze on their skin this morning. And so that's when I know, you know what, you can be grateful nonetheless. Peggy, did you reach Tony? And Peggy's on mute.
I'm trying to reach him right now.
Okay. So I reached him last night and he said he was going to be here. Tony Gillespie, I'll introduce him as he's coming. As I'm believing that he is coming, and I am so grateful for his pending arrival. He is the Vice President of Public Policy and Engagement, I think is his title, for the Indiana Minority Health Coalition. And the Indiana Minority Health Coalition, aka IMHC, is one of our biggest grantors. They are based in Indianapolis and have affiliates throughout Indiana. And we are their Allen County affiliate, okay? And so, you know what? I just texted him again. So as Tony prepares himself to come on out, why don't we do this? We're going to switch the agenda around. I've already talked a little bit about our announcements here at Health Visions. Good morning. And so what I want to do is for you to talk about your announcements. What have you got going on in your various organizations that we should all know about? This is the first meeting, the first ACHEC meeting of 2022. Yay, 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 yay. Oh, y'all, there he is. I see the face that has popped up, and it is none other than Mr. Tony Gillespie. So forget what I said about us doing announcements first. We're going to tune in to Tony Gillespie and what he has to say. Tony, I have already kind of introduced you, but if you can tell the folks here a little bit about yourself and what you do, and then Tony's going to talk about something that's very important for us. I wanted to start this 2022 year off with ACHEC talking about advocacy and policy, because I think that that's something that we really, really want to get into even more this year. That's what the Food Exodus Project that I was telling you about that we're going to do at 12 noon today is an advocacy project where we are bringing people together and speaking out about food deserts and food insecurity in Fort Wayne. And we're going to have public officials there and all of that. So that's advocacy, and that's talking to the people, leaders, about the needs of the underserved. Tony does that all the time with IMHC, and he is engrossed now in the general session with all those politicians and legislators and all that kind of stuff about what he does. And Tony then out for and be advocates for on behalf of the underserved that we serve all the time. Tony, the floor is yours.
Good morning. Thank you so much. I hope I live up to all the bullet points that Sharon talked about, but good morning. I'm very happy to be here. I'm Tony Gillespie. I am the VP of Public Policy and Engagement for Indiana Minority Health Coalition. IMHC is a statewide agency. We have 22 agencies and affiliates that we fund around the state to address health disparities and chronic health conditions that disproportionately affect minority communities. Health Visions of Fort Wayne is one of our partners that we fund to do that work. Sharon talked about the General Assembly, the legislative session, which began in January. And just a little background, this is a short session. So this session will run from January till probably the end of March, although they're trying to close early this year. Our budget is set on a biannual basis. So next year will be a budget year. And so generally the short session is used to quite often just lay a foundation for legislation that is brand new, might be a big paradigm shift or something that you're seeking some funding for. That's what short session is really used for. This session is challenging, just like the last session. Last year, and I don't know if everyone is aware that there were a number of issues that were predicated on race and ethnicity between, not usually it's just Democrat and Republican, but this time it was Democrat and Republican and black and white. And so things got really tenuous last session. So this session is just kind of is really a continuation of that. But what's happening is that in a Republican controlled legislature, they're really not hearing a lot of the Democratic bills, and then they're not hearing bills from the Indiana Black Legislative Caucus as well. So a number of the bills that I think the important health-related bills are bills that probably, or somewhere along the way was something that a Democrat discussed, but to make sure it got through the legislature, there's a Republican author or sponsor on it this time around. And so it's just something that we're working through. It's something that we're working through. The legislature, the Indiana Black Legislative Caucus and the Republican Caucus have been working. They started working over the summer, and they're rolling out some products this year. They did some things on race and ethnicity. They want to do some things on diversity, diversity and inclusion. They are doing a movie night on important movies that they think that either African Americans need to see or white people need to see. So it's just they're really trying to address the racial and ethnic issues that permeated the session last year to make sure that we don't end up with our legislative house divided based on race and ethnicity. It's a dangerous place to be, but it's a discussion that we have to have. And we know that COVID has really exacerbated a lot of that and what's going on in the country. So that's my diatribe on that one. But in terms of legislation, some pretty important bills that have been submitted and that are going through the process. So today is actually second reading on a lot of the bills. So the session is really going fast. Second reading, generally all of the amendments and public testimony have been taken. And so second reading, you're just cleaning up the language on the bills, and then the bills that have been approved at the House go to Senate and vice versa. So we're right at on the cusp of when the bills that originated either in the House or Senate then flip and go to the opposite caucus. And so there are a lot of things that we'll get a second bite at. We'll be able to go through and discuss, but let me talk to you about three really important bills, I think, that really speak to a lot of the work that we do at the state level and also with our coalitions and our affiliates around the state. And at any time, please stop me because I start talking on this and I just keep going. So please stop me. House Bill 1140, which is introduced by Ann Vermillion out of Grant County. That bill specifically is about Medicaid coverage for postpartum women. Last year, Indiana announced that they were expanding Medicaid for postpartum women from 60 days to 1 year. Those funds came out of the American Recovery Act, and Indiana was, I think, the second state. Illinois was first. Indiana was the second state to announce that they were expanding Medicaid. For Indiana, that's significant. Indiana is number 3 in the country in terms of our maternal death rates. Per 1,000 live births, about 43 white women die a year and 53 Black women die per year. So we're right at 100 that we lose moms every year to some health-related issue, something having to do with pregnancy. And so the way that comes out is that, women die because they get pregnant in Indiana. And that's something that we're working along with the governor's office to change both infant and maternal mortality. So the expansion of postpartum Medicaid was extremely important because that window that many women die postpartum is in that first year. So to expand Medicaid from 60 days to a year made perfect sense. And so this bill is really to codify that because the expansion was based on federal funds. So this bill, House Bill 1140, codifies that and makes it permanent so that the state will have to go into the Medicaid budget and make those dollars to expand it permanently moving forward from now until. So that's a great bill. That's one that we supported. And Ann Vermillion is a great legislator. She works with our coalition in Grant County. So we're very excited about that bill. And then I'll send you the bill digest. Sharon, I'll send you the bill digest on all of these, and then you can share the legislation with the group. The second bill is House Bill 1294, which is primarily to end the restraint of pregnant women who are incarcerated. So Indiana was one of 9 states that still made it legal for pregnant women to be shackled, pregnant women who are incarcerated to be shackled. That's anytime during pregnancy, during examination, during labor, during birth. And so that was one of the bills that we wanted to see removed. That was an effort that we led. And in the rising maternal mortality environment, we thought that this was barbaric, that it still existed. And like I said, we were one of 9 states that had this. So we went directly to Department of Corrections, Dr. Kristen Doss, who's the medical director for Department of Corrections. And she said, as soon as I took over, I abolished that in-house so nobody shackles here. But once we explained to her that it was a bill, that it was a law and it was legal in Indiana, she threw her support behind it 100%. So 1294, which was filed by Dr. Rita Fleming, who is a state representative out of, not Evansville, I think Jeffersonville, New Albany area. This is a piece of legislation that she supported. And in addition to the eradication of restraining pregnant women, there was also language added that made it a requirement that when women come into a Department of Corrections or into a jail, they are tested for pregnancy within 14 days. If they are pregnant, they immediately go for prenatal care. And it was actually something that language was included to ensure that all of the jails around the state, all of the sheriff's departments, the sheriff's jail, the county jails, that they did the same thing for pregnant women, because it's we don't, there's no consistency. So this was an effort to improve conditions for pregnant women who are incarcerated.
Tony,
Yes,
just
yes.
a quick clarification. So were pregnant women, is the bill saying that pregnant women can't be shackled at all, or they cannot be shackled during labor?
The language says that unless there is an extenuating circumstance, if it's a violent criminal, if it's someone who's prone to flight, but otherwise they shouldn't be shackled.
So in previous times, there were places where pregnant women were actually shackled to the bed while.
Yes.
Okay. I just wanted to clarify that and make that clear to someone who may not have known that.
Yes, and I don't do a good job at talking and watching the chat. So if you can watch the chat for me, that.
Yeah.
And what I can do is send some news articles, because in the last 2 to 3 years, there were a number of high-profile incidences in different parts of the country where women were shackled during pregnancy or left alone, shackled, and gave birth. So
Aaron is just saying we've heard reports of women being shackled during labor, even when they've had an epidural. Yeah.
Yeah. Yeah, a lot of horrific things have occurred. So this was our effort to ensure that that didn't happen again. And a big reason was, yes, maternal mortality, but also we've sort of been on the forefront in pushing that in minority communities around the state, that women have access to doula services. Doulas, not a midwife, but a pregnancy support or like a pregnancy coach. Our doulas follow moms from a point of entry into the program all the way until the first birthday of the baby. That's to ensure that during pregnancy, mom has a healthy pregnancy, and that the doula works with her to navigate the healthcare system, to help her advocate and get the things that she needs to ensure successful, healthy pregnancy outcome, and then support mom in that baby's first year of life. All families are not two-parent families. Financial issues, childcare issues. Our doulas work with mom to find resources to alleviate those, just to ensure that in that first year of baby's life, that mom stays healthy and baby stays healthy as well. So 1294 was a shackling bill. And unfortunately, it passed, but there was some miscommunication. So all of the care items that went along with it when women enter a DOC facility or a county jail, all those, that language was removed. And I'm not sure if it was removed because they just wanted to get it through the legislative process, because it didn't go to the health committee. It went to courts and criminal. So I don't know if they removed it so that wouldn't be a sticking point, but these are things that the state jails already do. And the idea was to have this in legislation so we can ensure that the sheriff's departments, the county jails, get the same thing. So we're just exploring if we can put that language back in on the Senate side and get it passed out. And so that once it's passed and it becomes law, it's inclusive of those things. And then all of the jails around the state move to in the same direction to provide better care for women. The third
what was the language that was removed? I'm sorry.
So when I send the bill, and I'll include it in my little description, but from page three, line 35 all the way to page 4, line 25. And that doesn't mean anything now, but when I sent it, you'll see it was all language that was specific to when women enter a Department of Corrections or jail facility, they are tested for pregnancy within 14 days. If they are pregnant, it was all of the care instructions and the idea of making it more consistent across the state. So that language was removed. So we'll just see if we can put it back.
Okay, gotcha.
Okay, the other bill that I would like to talk about, and I'm just trying to find my place. It was a bill that was sponsored by, I'm sorry, give me just a minute. Sponsored by Sheriff Pryor, State Representative Sheriff Pryor. I'm one of those, if I don't have it in front of me, I will forget.
Okay.
So
is it one of those that we talked about yesterday?
no.
Oh, okay.
So give me a hot second. The bill was specifically looking at discriminatory lending practices.
Oh.
When technology doesn't work,
it just doesn't work.
It just doesn't work, and it's just not working. So anyway, I'll find the bill number, but the bill specifically was talking about predatory lending practices and racial and ethnic discrimination. There was a huge case that rose to the federal level here it originated in Indianapolis, where a Black woman put her house up for sale. And it was in a neighborhood that is experiencing a lot of growth and change, where they're going in and rehabbing houses and then selling them for a lot of gentrification. And so she did a lot of the work to her house. She had a relative, and the house was great, so she put it up for sale. And the appraisal process, it was appraised significantly less than other houses in that same neighborhood. And so she thought, okay, well, this is low. Let me call a different company to come out and do the appraisal. She called a different provider to come out to do the appraisal. And same thing, it turned out dismal in terms of the value that was placed on it and what she was told she could sell it for. So she did an experiment. She called a friend of hers, and the friend sent her husband, a white friend, sent her husband over. And they took down everything in the house that had any reference to African-American, all of the pictures, paintings, statue, anything that made the house look like a Black person lived in it. And so they set the appraisal up, and this time the white couple met the appraiser, and he walked through the house and did the appraisal 3 times more than what it appraised for the first 2 times, and even appraised higher than some of the other houses that sold the median in the neighborhood. And so that was clearly, directly discriminatory. So this bill that was sponsored by Indiana Black Caucus member Sheriff Pryor speaks specifically to those issues. And they even included testimony from the woman that happened to. And so that's something that's happening around the country. And so it's happening here in Indiana as well. So I just chose those 3 to talk about. One, the maternal mortality rate is a huge issue in Indiana. And if you think about it, so Indiana is number 3, and we're sandwiched between Louisiana and Mississippi. And so, Southern states have the worst healthcare for minority in terms of underserved populations. So we're stuck in the middle of 2 of the worst, which I always say Indiana is always either at the top of the bad list or at the bottom of the good list. And so we have to work to somewhere meet in the middle and change that. So that's why I offered the health bill, specifically the ones that address healthcare for pregnant individuals. And we are, with the health disparities as they are, we are building generations where women are terrified to get pregnant, and really at risk. And one of the a study that was done, a CDC study that was done, some of the findings were that women, so it said my grandmother, I'm 50, I'll be 57 in March. So my grandmother was safer than any of my nieces will be when they deliver. So if we think about healthcare back in the 60s, and for my grandmother, it would have been in the 40s. So if Black women were safer in the 40s in the midst of racism and segregation and all those other things, safer than they are now, then we've got some major problems that we have to address. And
How are they safer, Tony?
safer in terms of the morbidity around deliveries. Women didn't die at the rates that they die now. And the United States is the only country with the more maternal mortality rates that we have. We're the only country. Our maternal mortality rates are higher than some third world countries. So it's a significant issue. And I know in Fort Wayne, Parkview has tried to do a lot of work around maternal mortality. And COVID has impeded that significantly. There have been like 2 or 3 things I was scheduled to participate in around maternal mortality to have this conversation. There was going to be a conference. And I want to say the nurse that I've been talking to off and on for the last few years, I want to say her name is Carmen.
Carmen Moore. Probably.
Carmen Moore, yes.
Yeah.
It's just been COVID that has impeded that. So we still got a lot of work to do. So of course, as we continue to do this work, we're going to look to Health Visions of Fort Wayne to help carry that message to minority communities.
Tony, we've got a couple of, I'm sorry, we've got a couple of comments in the chat about some of the things that you said. The story with the woman whose house was underappraised, was that in Indianapolis?
Yes.
Oh, wow. Okay. And Colleen Carpenter is saying that she thinks the bill that you're referring to is House Bill 1326.
Yes.
There you go.
Thank you, Colleen. Thank you very much. And then I see there were also some comments. Colleen, doulas are awesome. I love the idea to help mom and baby in the first year too. Thank you. Our doula program, we're very pleased and proud of it. It has had a lot of bumps along the way. A lot of that, and another piece of legislation that was that we supported was the safety pin funding, which is the state's funding to address infant mortality. Safety pin funding did not have a racial and ethnic funding mechanism. It was only based on area. So if Health Visions of Fort Wayne applied for a safety pin grant, you would have to agree to serve the entire region versus a racial and ethnic group. And with our safety pin grant, it was specifically targeted to provide doula services for Black and brown moms, Black and Hispanic moms. And the mechanism, you get 80% of the funding upfront or reimbursable. They make it available. And then when they check the infant mortality rates, if there has been a decrease, you get the other 20% or whatever the percentage is. You get the rest of the money. If there's been an increase, then your grant ends, you don't get the money. And so our doula program specifically is in South Bend area. So we were serving South Bend, St. Joseph County, LaPorte County, Elkhart County, and then with the different grant, Cass County. So the South Bend or St. Joseph County grant ended because the infant mortality rate went up, but the infant mortality rate increased among white babies and it decreased with Black and Hispanic babies. But we were still held to that rule, and then our funding, we lost our funding. So we since have been working with the State Department of Health to change that because there is no, the infant mortality rates in Indiana are significantly high because of the Black and brown, specifically Black infant mortality is extremely high. And over the years, there's been very little decrease in that. And Indiana does not have an infant mortality plan specific to address Black babies. And so how will we become the best? I can't remember the governor's, the verbiage, but the governor's office is looking at this well, and they want to see infant mortality go down. If we don't fix Black infant mortality, then we don't fix we don't fix infant mortality for the state. So it's part of that effort to really begin to focus more on racial and ethnic minority communities to address some of these health disparities. And then the housing bill, I chose that one just because it's part of social justice. Housing is healthcare. You can't get quality healthcare and consistent healthcare if you don't have an address, if you're homeless. And home ownership is part of that continuum as well. Okay, so I'm sorry, Sharon.
No, I'm sorry. Yes, thank you for that summary. I just wanted to make note of a couple of the things that people were saying in the chat. Sylvia Wade says she knows of a couple of situations where women have had complications during childbirth. And then Dr. Diana Jackson was talking about renters and buyers and housing discrimination. So I think the people on today are really sensing, are really feeling the House bills or the bills that you chose to highlight. And also we have a program coming up in February. Our own Patricia Beasy, wellness coordinator, is going to be talking throughout the month of February with some financial experts, and they're going to talk about some predatory lending practices and things like that. So we'll want to stay tuned and tell our clients about those opportunities as well. So I want to open up the floor if anyone has any questions for Mr. Gillespie. We've been saying quite a bit here in the chat. I have one question, Tony. What do we need to do? You were talking about this being a short session. Should we be calling our, representatives, our local representatives? What do we need to do here to be advocates?
Well, first of all, thank you to everybody that's thanking me in the chat. I love this work and I love doing this. And I see Dr. Jackson. I've known her since we started working with Health Vision. So thank you guys so much for being here, and thank you for your input and your ongoing support. So what can we all collectively do? Advocacy is so important, and what this coalition can do is contact your state representative, Phil Gianquinta. Phil is great. He's been very supportive over the years, and Phil is great. I think you should also reach out to your senator,
Liz Brown.
Liz Brown, and actually, I don't always agree with Senator Brown. She has a very, very, very strong right to life, anti-choice stance, and a lot of the anti-abortion where, eroding the option for women to make informed decisions about how to handle pregnancy. She's led a lot of those conversations. But on the flip side of it, she was the one senator that had a number of questions or concerns about our doula bill a few years back that Senator Jean Breaux sponsored, which sought to provide Medicaid reimbursement for doula care. And Senator Brown had a lot of questions, and she took a lot of hits, or she shot a lot of hits at us for that particular bill, but it passed out of the Senate anyway. And when it went for appropriations, I thought rather than bring a doula from South Bend, I'll just study up on it and I'll testify. But I didn't think that Senator Brown was on appropriations. So I'm sitting out in the hall at 8 o'clock in the morning thinking, who gets up at 8 o'clock in the morning? And so I'm really just trying to take a nap before it's my turn to testify. And then whose voice do I hear? I hear Liz Brown. I think, oh my God, I did not think she was going to be here. She is going to tear me up. And so when I testified, she was the only person. She sat up, she turned her mic on, and she was rapid fire, a lot of questions. But her questions were logical questions. Her questions were trying to understand that a doula is not a medical provider. And once I explained that's not the role of a doula, that's not the training, that's not the certification. Doulas are support. They are part of the labor and delivery team. And doulas is evidence-based. They've proven to be effective in improving health and birth outcomes. That's all we want to see happen. This is not to usurp any of the authority or knowledge of the medical team, not the doctor, not the nurse practitioner, not the anesthesiologist. And once she understood that, she even went to the floor and she supported the doula bill on the floor, which helped us get it out of Senate. So the best thing that you and other advocates can do, talk to your legislators, get to know them, and they need to know you. They need to know who Health Visions is. They need to know that you're representative of a significant number of other providers and consumers in that area. They need to know you. So that way, when we seek more funding to fund the Minority Health Initiative, which we've done that over a number of years, but last session, last year we did very well in the state budget. Our dollars were increased, but we've been flat funded since the 90s. And so that increase was just part, we're still not at market share. So we're going to be going back asking for more funding. And I'm sure that Sharon and the team have shared some of the work that we do statewide. We have a statewide network that meets every Tuesday, and we've done everything from COVID. And, my hats off to Health Visions. Some of the COVID work that you guys did was faith-based leaders around the state and the Greek. You did some incredible videos and just some incredible efforts to get more people vaccinated. So thank you for that continued work. But the best thing that you can do is communicate with your right now, I think the best thing you can do, you might try something on a Saturday.
Okay. Well,
You set that up, I will support it and walk it to both of them and make sure that they respond.
Thank you so much, Tony. And we thank you for your presentation. I'll just look at some of the comments here. Kim is suggesting maybe a letter that we all sign supporting some specific legislation, and we can certainly look into that. Colleen is saying that, okay, Colleen made note that Senator Brown's husband is a healthcare provider, and so
Right.
to that. And I'm sure there are people on the call that are agreeable with her stance on abortion. Certainly the Poor Handmaids of Jesus Christ, which owns Health Visions, would be as well. And so there are some different comments here. Oh, Andra had to leave. Should we send other emails or make calls to other senators not in our area to express support for these bills? Is that a tactic, sending information to other senators who are not local?
I mean, it wouldn't hurt, but generally, legislators listen to their constituency, who's going to vote for them next time around, or who will vote against them next time around. So it wouldn't hurt to send it to other legislators, but really, your legislators are important. All the legislation I've talked about, session has moved so fast. All of these bills have been heard. So I think when they hit the Senate side, that might be the time that we push a button and flood the legislators with calls. And so we're readying those alerts now. We really don't have any indication that we're going to hit snags. So like with the shackling bill, we're going to get that language back in there that was sort of streamline that around the state. Now, there are a couple of bills that we didn't get hearings for. Robin Shackelford had a bill to address cultural competency and inclusion training for healthcare providers, and it really stemmed from the doctor that passed away, who was in the hospital for COVID. It really was born out of that tragedy. And Representative Shackelford was aggressive. She went to the national caucus of state representatives. There's a national group that meets, and she presented it there and got national support on it. And then she went to the caucus for Black state legislators, did the same thing, got national support on it, came back to Indiana, couldn't get a hearing. So we've got some work to do in terms of what's important. And while economics are important, healthcare is equally as important. And unfortunately, the only thing that I've heard our legislators say, Speaker of the House, Todd Houston, was quoted in an article over the summer saying that his goal is to make sure that Indiana is the most extreme right to life state in the union, meaning that abortions will be eradicated here. And that's his opinion. But if that's what we're striving for, we're not striving to decrease infant deaths or maternal deaths or improve healthcare. We're striving to restrict abortions. Personally, I don't agree with that, and I think that how that should be a goal for the state. I'm not sure that makes ounce of sense to me when there's so many other critical issues that we need to address. But that's where we are in Indiana, and there is a whole lot of room to educate legislators. And one thing that I'm most pleased and proud and humbled about Health Visions Fort Wayne is we don't get the confusion. Oh, we can't talk to legislators because we might lose our 501c3. We can educate legislators all day long. And that's all we're doing is educate. We're not lobbying for a specific outcome that will benefit us. We're educating for the masses.
Tony, thank you so much for your time today. We really appreciate you. We're going to move on to any introductions and announcements that we have. You're welcome to stay on with us. And you're going to send us an email with these bills. And when Tony does that, we'll definitely send that out to everyone. And we will talk then also about maybe crafting a letter and when would be a good time to do that. Okay. Thank you, Tony.
Thank you so much. And I will hang out for a few minutes. I'm going to put some stuff in the chat.